This podcast is for support and inspiration only. It is not medical advice. Always talk to your doctor or care team about what's right for you.
You lost the weight with Ozempic or Wegovy or just bariatric surgery. But now, the mirror is telling a different story. Loose skin, body image struggles, and zero warning about what comes next. In part one of this conversation, board-certified plastic surgeon and post-massive weight loss body contouring expert Dr. Daniel Kaufman breaks down what Ozempic body really is, why no one is talking about it, and the emotional fallout of reaching your goal weight, but still not feeling like yourself. Let's jump right in. All right, we are here with board-certified plastic surgeon and post-massive weight loss body contouring expert, Dr. Daniel Kaufman. And he's here to have a really good conversation with us today. Good morning or welcome, Dr. Kaufman. How are you today?
Good morning, Zatoya. I'm doing great. Pleasure to be here. Thanks for the invite.
Thank you for coming. Can you go ahead and tell our audience a little bit about you and your work and what you do with your patients?
Sure. So I live and work in Miami. As you said, I'm a board-certified plastic surgeon. I do everything from the neck down. I do tummy tucks, liposuction, high-def lipo, my share of BBLs, of course, all kinds of cosmetic breast operations, augmentations, reductions, combinations thereof, implants, fat grafting. And one of my true loves and what's become actually my area of expertise is post-massive weight loss, as you said, body contouring surgery. So if you've lost a whole bunch of weight, 100 or more pounds, or maybe even not that much, but you've got folds of excess of skin, that sagging surplus skin in all circumference or all aspects of the body, I do those operations. So belt lipectomies or total body lifts, extended tummy tucks, arm lifts, thigh lifts, breast lifts, upper, lower belts, you name it, I get it done. So if there's any excess skin to remove, I'm your guy.
Wow, I didn't realize you had that many options.
Most
That's a
people
lot of
don't, as a
different
matter of fact, and it
surgeries.
kind of hits them by surprise when I tell them about, well, here's what we can do, and kind of,
Yeah,
their eyes kind of open up and say, oh my God, yeah, didn't
that's a
realize that
lot.
there is so much in this world, yeah.
Yes. So let's go ahead and jump in with my first question and talk about something that is not mentioned often. What is Ozempic body and why is it becoming such a problem now that GLP-1s are becoming more and more popular today?
Yeah, so I guess Ozempic body is just just another term that's been kind of created out there to describe the post-massive weight loss body and the problems therein. So Ozempic, as you alluded to, is a GLP-1 agonist, which GLP-1 is one of the so-called incretin hormones. It stands for glucagon-like peptide, and it's just one of those hormones within the huge system of endocrine and nerve cells in the body called the brain gut axis. And we can get into all of that stuff if you'd like. But basically, the GLP-1 agonists or the drugs or the medications that mimic that hormone, the incretin hormone, they have a lot of beneficial effects, cardioprotective effects. They protect the heart, the kidneys. They've been used originally as treatment for diabetes mellitus. And
Mhm.
what we've noticed in the past few years is that they have an incredible effect on appetitive behavior. We realized that they work on the brain, on that very small part of that brain, which controls our appetite and, the cravings, or, essentially what makes you get up in the morning and want to open up the fridge. It's that part of the brain that receives input directly from this hormone, the GLP-1. And these drugs mimic that natural hormone that occurs in our body, and they create massive suppressant effects on our appetite. So because of that, people have been using it, doctors have been using it with their patients to lose massive amounts of weight. And people are just taking these medications, and all of a sudden, out of nowhere, they stop their cravings. They, reduce their weights by 100, 150, 200, or even more pounds. And next thing you know, the skin, which doesn't have all that much time to react in the appropriate way to contract and recoil as we would like it to, And next thing you know, you're left with massive amounts of surplus skin, those, very cumbersome folds of skin in all aspects of the body. They're on the abdomen, the back, the arms, the thighs, you name it, and they're there. So Ozempic body just kind of describes that state of being after you lost a massive amount of weight. Now, it's not only confined to Ozempic, although we just want to talk about Ozempic body because it's the recent global craze because all the
Yeah.
celebrities have been on it, and then frankly, it's been kind of hyped up on social media. But bariatric
Yeah.
surgery, bariatric endoscopy, and other ways of losing weight can often result in the same kind of body habitus or the state of being of the body. And yeah, and it's a massive problem for many people. And as you just covered or said a moment ago, so many people don't even realize that there are options to try to make the situation better, to ameliorate it and treat those massive folds of excess skin. So here we are.
And I loved how you explained how Ozempic works. Like, I thought it was just kind of an appetite suppressant, but it's really kind of attacking that mental aspect of weight loss and helping you with your cravings and that brain thought process. So that's why I heard that it does help with weight loss, but like other habits that you may have, it kind of helps with that too. Like if you are alcoholic, it helps with those type of cravings as well, because it's more addressing like your brain and how it's being communicated.
Yeah, it definitely has effects on the brain, and it's something that I don't know how much into the science you want to get into, but as you just spoke of the brain gut axis, there's a whole humongous system of nerve cells and endocrine cells. And endocrine just means cells that make hormones. So, and hormones are just kind of basic physiological molecules. They're little biochemical molecules in our body that transmit signals from one organ to another. And we realize now that what we call the enteric nervous system, or the nerve cells of the guts, essentially, and not only the guts, but the intestines, the stomach, and also connected intimately with the liver, pancreas, kidneys, adrenals, all these internal organs. They're all connected with a massive amount, maybe even more than 500 million nerve cells, if you can even imagine. And all those
Mhm.
cells are connecting intimately with the brain. And it makes sense, and, why do we have, all these connections that we can think of that, let's say when you're nervous and you feel it in your guts or your
Mhm.
stomach churning, even all these things that we say in our common language, the reason for it is the physiological basis, which is that intimate connection between the guts or all the internal organs. And I might use that kind of interchangeably here and there,
Mhm.
but the guts and the brain are connected in a very complex and intricate and redundant way, as a matter of fact. And that's why, as you're saying, the GLP-1 agonists, Ozempic, Wegovy, Trizeptide, they're all working not only on the intestines, the stomach, the liver, and so forth, but they also work discretely on the brain and in the very primitive parts of the brain, the hypothalamus, which is that little tiny organ in the very middle, kind of like inside part of the brain, which controls all the basic life functions like wanting to eat, like wanting to sleep, the sleep wake cycle, fever and temperature regulation, all those kind of internal things that nobody ever thinks about. They're governed in the hypothalamus, and that's what those medications are working on.
That's very interesting. So it makes sense though. Everything's connected. Duh.
Absolutely.
So some people feel blindsided after massive weight loss, especially if they are expecting to look a certain way after they've reached a certain goal. So they think, okay, I lost 100 pounds, but I don't look how I thought I would look at losing 100 pounds. So what are the emotional and physical shocks have you experienced with your patients when they realize that, the skin may be just as big of a problem as the fat?
Yeah, it's almost heartbreaking to see how many patients come to my practice and they lose all this weight, and clearly they know and they feel the massive beneficial effects, physiological effects on their body. Their blood pressure goes down. They're able to control their blood sugar much better. They don't have those massive spikes of blood sugar, after eating, and everything. They breathe better because less of pressure on the diaphragm or the breathing muscle, the muscle that expands our chest cavity. Some of them, a lot of them are even more fertile because they get pregnant after, the Ozempic babies. That's a thing that's kind of come out there on the internet. So there are so many
Mhm.
beneficial effects physiologically on the body. Yet, for one reason or another, so many people are so despondent and they feel so bad, and because the body image that they have of themselves doesn't change. And as a matter of fact, for a lot of them it gets even worse because they look
Mhm.
at themselves in the mirror, and as you said, they expect themselves to be this thin, maybe high school or college version of themselves before they got into the massive obesity state of their body. Yet they're not there now because the skin, which has been expanded and essentially damaged by that incredible stretching that happens when we get to those massive obese states, it hasn't had a chance to recover and contract and recoil the way that we'd want it to. Kind of like, I make an analogy with a lot of my patients is that we want the skin to kind of shrink like a saran wrap, one of those plastic wraps on a hot dish, when you put it on and it
Mhm.
kind of sucks in,
Mhm.
and that's what we want. But unfortunately, that doesn't happen. And the reasons for that are numerous. Obviously, with some people, it does happen, and it always happens to a degree. And a lot of women who, let's say, have been pregnant, they can attest to the fact that, well, right after the day after you give birth, well, all that skin and the abdomen, it's there, and there's stretch marks and all that damage to the skin. Yet, after a few months and definitely after a few years, a good bit of it comes back and shrinks up, yet somehow or other it just never does completely. And what
Yeah.
happens when we experience a massive weight loss, and especially when we do it in a very fast way, which could happen with some of these medications and bariatric surgery or endoscopy, then again, the skin does not have the appropriate time to shrink up and recoil. So people look at themselves in the mirror and they feel so bad. They feel awful. And some of them, believe it or not, actually tell me that they regret losing the weight altogether, which is a horrible
Mhm.
thing because we know and they feel that they're healthier, that they're better off. The quality of their lives has increased. The longevity of their lives for sure has increased. Yet they still feel so awful, and they have those feelings of remorse and regret. And it's just an awful thing to see. But there's hope, and
Mhm.
that's what they come to me for, to kind of to get rejuvenated, to restore the contours of their old self. And that's why I'm in the game. That's why I'm in it, because it's a wonderful part for me to be part of that journey, especially when people are feeling so down and out, almost at the bottom of an abyss, so to speak. But yeah,
Mhm.
I get to be part of the solution to help them with their troubles. So it's a wonderful thing.
Yes. So let's be honest for a second. I know once you are meeting your patients, you kind of get at the after effect after they started their weight loss journey. But do you think, just as a whole, the medical field is setting people up with unrealistic expectations by not going into more details about what to expect after that major weight loss? I know for me personally, for my surgery, I got a lot of prep on the surgery itself and what to expect with like recovery. But I feel like past 6 months, it was almost kind of like, all right, you got this. And it wasn't as much support or, just those honest conversations like, hey, your arms are going to sag or your feet are going to shrink. Wasn't really communicated with me a lot in my journey. So just as a whole, what do you think about that? Do you think it's being done properly or enough?
So I agree 100%. We're not doing it enough. We're not doing it well enough for those who are doing it. And I think this is part of the reason why we're here today, talking about it and being as honest as we can be about it. And I think this is a big reason why the fields of bariatric surgery and endoscopy, I
Mhm.
think that those fields with the massive weight loss and just weight loss and health maintenance in general are merging together with plastic surgery. What people used to think of, sometimes, and still people do think of plastic surgery, they kind of they put it down and they say, oh, it's superficial, it's just a vanity, and it's for people who just care about their looks. And I think today we're realizing that so much of plastic surgery is on the reconstructive element, and the reconstructive and cosmetic elements kind of merge into one, especially in the case of bariatric surgery, in the case of patients with massive weight loss. So I think, yeah, we probably don't talk. Well, not probably. Let me say it. I'll put it out there, and I'll blame myself and my brethren in the healthcare industry. We don't talk about it enough, and we don't make people realize enough that, number one, when you do lose the weight, okay, yes, there's going to be all those beneficial effects, but there are going to be problems later on, and those problems are not just cosmetic. They're going to be on a reconstructive side because it's incredibly tough. Anyone who's lost even 50 pounds of weight, you realize right away, wow, it's hard to get around with those floppy, sagging folds of skin. Sorry to use the graphic terminology here, but why
That's
not?
real.
Let's be honest here, right? Let's
Yeah.
just put it out there and talk about it. And I think if plastic surgeons, if not only us, but healthcare personnel in general, if you're hypertension specialist, if you're diabetes endocrinologist, if they talk to you honestly and say, look, you got to lose the weight, you got to be healthier on that side, but don't forget that afterwards you're going to experience some of these issues, and these issues on the whole, they all involve, after all, mental health, and we can't overlook that side of it as well. So we
Mhm.
all need to be better at it. Surgeons, diabetologists, hypertension, medical weight loss specialists, psychiatrists, psychologists. We all need to be involved and do a better job at educating our patients, educating ourselves in terms of what could be the potential problems after massive weight loss. And, I keep preaching this. I feel like I'm on a soapbox every day. Obesity is the biggest problem, the biggest medical problem that the world has ever seen, and man, if we're going to tackle this problem, we're going to see a lot of the other problems with the sagging folds of skin on that back end. And you know what? It's all related. We all have to treat it kind of as one goal to restore our physicality, but not only that, but restore our mental health. And plastic surgery is just an integral part of it. Once we do lose the weight, but you know what? If we start talking about it early, we're all the better for it.
And it's like it'll prepare you for that next step of, okay, even if it's not 6 months after, in a year or two, you're going to get to this point where this is a possibility. So you can already think about what that's going to look like for you financially.
Mhm.
If your insurance is going to cover it, you can already have those things kind of like in the forefront of your mind so you can prepare. So you can prepare for that step just as much as you prepared for the surgery or starting the GLP-1s too. So it's kind of like, let us know. We want all the information.
Well, this is why we're here talking, Jatoya, and I commend you on your efforts in doing that and just being so honest. And I told you earlier that I got a chance to binge a little bit of your content out there, and it's awesome. I think it's great. It's so it's something that's so taboo, so to speak, to talk about
hmm
the those problems with gathering the folds of skin when you're getting dressed in the morning and running around, and being embarrassed to go to the gym because you got the bat wings hanging off or the apron in
Yeah.
front of your in front of your abdomen. And I tell my patients this all the time: you can't embarrass me anymore in this room. Whatever you want to call it, go ahead, call it that. I'll join you in the process. Let's be honest about it. Let's even have a little bit of sense of humor about it. And when we start to open up like that, then we can be a lot more forthcoming in finding the solutions to these problems. So good on you for doing this effort, and I'm happy to be part of it.
Yes, thank you. Just wanted to have some open, honest conversations without the judgment. So that's the goal for this show. And I'm so thankful that you see that in this journey of mine that I'm having.
If this is hitting home, go ahead and follow the show. And if you haven't already, join the Facebook group Bariatric Paths, Your Journey, Your Tribe. You can also sign up for the email list at bariatricpaths.com for updates and event info.
So what are the biggest misconceptions people have about skin removal surgery?
Well, number one, that it's purely for vanity. That's the thing that I try to kind of hit first with my patients, to let them know that don't feel bad about asking for this kind of surgery, and don't feel bad about wanting to look and feel your best. Plenty of people do it who aren't suffering from obesity or dealing with these problems like weight regain and all the other medical problems, the comorbidities that come around with it. And I tell them, look, the fact that you want to do this, it's actually going to help you out from a medical perspective. There's actual data out there to show that, what's the number one problem with massive weight loss? It's weight regain. The vast majority of people who, and it's a sad fact today that the majority of people out there who lose weight, and basically any amount of weight, whether you're talking about 100, 200 pounds or just 20, 30 pounds. And probably now we're relating this to a whole bunch of more people in the viewing audience that can say to themselves, well, yeah, I've been on this yo-yo roller coaster kind of thing where I lose the weight and then I gain it back, and then I have my New Year's resolution and I want to go to the gym, and then I'm good for a few weeks or months, and then it just falls apart, and then I regain it back. So there's evidence to show that when you have the post-massive weight loss body contouring, when you have that extended tummy tuck, the body lift, the arm lift, the thigh lift, you're much less likely to regain the weight back. Now, why this happens, whether it's a physiological, biochemical thing that's going on, maybe there is. I think a lot of it is on the mental side because, once you're seeing the results of, well, wait a minute, wow, look at me and how I look. I got rid of this excess flap of skin at the abdomen and I can run a lot better. It just doesn't feel as cumbersome. I can go to the bathroom in a much easier way. It's easier to not have to deal with those folds of skin. Everything gets better. Sex gets better. And they realize, they're like, you know what? I am never going back. And they make that commitment. They redouble their efforts at maintaining their health habits so that they don't go back into that recidivism of weight regain. And the statistics show it. The numbers are there to show that when people do have post-massive weight loss body contouring, they do much better from the health maintenance perspective, which is why I go back to saying that this is plastic surgery, but it's not for vanity. It's reconstructive. It's restorative. It's actually part of healthcare.
This may sound a little ignorant, but after the skin removal surgery and you're all nice and tight, could you, if you did regain, would you stretch your skin out, or would you be pulling at where, you have those scars? Would you feel your skin stretching a little bit? How does that work?
Yeah, that's a great question. Nothing silly about it. So absolutely, you can regain the weight back and you can gain it back at any place. Now, remember, when we do remove fatty tissue cells and skin cells, they don't grow back in that area. We're not starfish. Once you take something away from the body, it never grows back. However, we can regain fatty tissue in other locations. And not only that, remember, there always are going to be fatty tissue cells remaining in any particular area. Even if we do liposuction, people, oftentimes they say, doc, suck me dry, get every cell of my body out there. Well, I can't do that, nor would you want me to do that, because fat cells actually are endocrine organs. They actually communicate with the rest of, as we said, the brain-gut axis and the muscles and all the other elements of your body. So you don't want ever to have everything removed from your body. The excesses is what you want removed. And you must remember that even when you remove these excess parts, you can always regain, you can always fall back into those habits. But as I said a moment ago, when you do have those reconstructive, restorative operations, you're going to be much less likely to do it because, you've invested so much in your body. And it's just, it's a wonderful thing to see my patients after having some of these surgeries. And oftentimes we have to have a series of surgeries because you just can't do it all in one shot. It's just too much on the body to take. And the best way to do it is a staged strategy where we take on the worst body part, the thing we hate the most, and then we say, okay, let's tackle that, and we live to fight another day. And then if we could do more operations in that regard, all of a sudden you're starting to see people blossom. They just, again, they redouble their efforts. They're much more health conscious and they take care of their health habits much better. They eat better. They move more. They get more active. Their relationships improve. I mean, I just can't say enough about this kind of plastic surgery. I think it's the best, and it really helps out in people maintaining their health and staving off that recidivism of obesity.
Absolutely. So what are some areas of the body that are most commonly affected by the massive weight loss that you kind of help with?
All right. So, so let's start with this. The core of the body is where I like to start. Now, remember, that's with a caveat there. I always make sure to listen to my patients. And the first thing we do is I ask them, well, what's the worst thing I can help you out with? And usually we go to that, whether it's the arms, the thighs, wherever it is, the breasts, I'll tackle that area, no problem. However, most often when I ask, what's the worst area? They tell me, well, it's my abdomen, and I hate my breasts, and I hate my thighs and my arms and my back and so on. And then we say, okay. Well, we have to focus on one thing because I can't do everything at once. So let's pick what's the most reasonable, most logical way to start. And most often it's at the core of the body. So that means essentially there's a few operations that we could do. Number one is an extended tummy tuck or abdominoplasty. Now, it's almost always more than just a regular tummy tuck. So regular tummy tuck goes essentially from hip bone to hip bone, but an extended tummy tuck has to encompass more of the excesses of skin because oftentimes it's present all around the torso or the core of the body. So extended tummy tucks essentially extend that incision along the bikini line to go around the hips and all the way to the very sides of the body, or as far as we can extend with you laying supine or on your backside on the operating table. So that's maybe one of the basic kind of things that we can do. Beyond that, sometimes people have excess of skin in the vertical element or at the upper abdomen, which means we can extend the extended tummy tuck into what's called a fleur de lis or FDL extended tummy tuck. Now, fleur de lis is just a fancy French term for the lotus flower. And if you can imagine the tummy tuck scar being a perfect smile along that bikini line, an FDL extended tummy tuck would take that smile and add a vertical component to it right down the center of the body. Why would you do that? Again, because there are excesses of skin in the upper abdomen, and we would include that to just get more of that excess off. So those are two major options you can do on the front of the body. Now, if we can extend...
I have a question before
you
get to the next step. So with like the vertical, if you have a situation where they say your muscles have separated from your abs, is that surgery going to address that, or would the regular tummy tuck do that?
Absolutely. So all tummy tucks essentially, maybe except for the mini tummy tuck, but that's not something that we would be discussing here. It's outside of the scope of this discussion. But all tummy tucks, regular tummy tuck, extended tummy tuck, FDL tummy tuck, they all involve the muscle repair. Now, what you're alluding to is the diastasis. There's a term out there called diastasis rectus or diastasis recti. Rectus refers to the vertical muscles of the abdominal wall, essentially the six-pack muscles, what you see on those crazy fighters or the football players where they have those 8 packs of, everything defined there. Well, those are actually vertical muscles that are in the midline of the abdomen, and they have these transverse inscriptions that kind of make the 8-pack or 6-pack there. But they're essentially vertical muscles. Now, with pregnancy, with obesity, with other conditions, those muscles can separate, and we call that diastasis. That's the Latin term for separation. So, part of a tummy tuck is to repair, to bring those muscles into a more midline or medial position, to reposition them, make them function better, and most of all, get rid of that midline bulge and make the abdomen much more flat, contoured, and athletic. So the diastasis repair, we call it a muscle repair kind of colloquially, and that's kind of an interchangeable term, but it's actually not repairing of the muscles because it's not the muscles that are injured. It's just that in the midline where they come together, they are separated. So we have to bring them into that midline position. So it's a diastasis rectus repair. And that is part of every tummy tuck that we do, including the ones I just mentioned, the extended tummy tuck and the FDL extended tummy tuck.
That's good to know. So what other areas do you usually tackle outside of the core?
Well, if we can, just for a moment, before we move on from the core, what we can extend to that is if we look at the excesses of skin, not just at the front of the body, but also on the back of the body. Well, now, if we flip you over, and anyone who's watching this who's lost a massive amount of weight, make yourself a little test at home. Take your hand and give yourself a good pinch. Now, I'm not talking about a little tiny finger pinch, but give yourself a hefty, good size pinch at the bottom of the abdomen. Now, do it at the front. Now, do it more so to the sides. And be so brave as to do it on the back side and see if you can grab a good hefty pinch of that excess skin and fatty tissue.
Mm-hmm.
Now,
I know
if you
I can. I
can,
don't even have to. I know.
yeah,
It's there.
right.
It's back there.
And I'm wondering how many actually of the viewers actually are doing it as we speak, and I hope everyone's doing it, because that's the way to know whether you're in line to get not just an extended tummy tuck, but what we call a belt lipectomy or total body lift. So belt
Is that the
lipectomy, why
same
we
as a
call
360? I've heard that term
so
too.
yeah, so it's
Okay.
different than 360 lipo, which is lipo is
Okay.
just liposuction,
Sucking
but
it out.
what we're talking about is a lipectomy. Now we can kind of make the distinction between the two. Liposuction is when we use tiny little incisions to transmit our long metal cannulas, and we do this kind of suction thing that I guess everyone's
Mm-hmm.
seen on the Instagram or YouTube videos
Yeah.
out there. It looks a little bit kind of brutish, but that's
Yeah.
how liposuction is done. And lipectomy refers to the actual cutting away of the excess folds of skin, wherever they are. So a tummy tuck, a breast lift, an arm lift, a thigh lift, they're all categorized as lipectomies, not liposuction. Now, we
Got it.
actually use liposuction in conjunction with performing lipectomies, but suffice it to say that when we say lipectomy, we mean cutting away of massive folds of skin. So,
Mm-hmm.
getting back to the core and what we can do if that hefty pinch goes all the way around the body, well, then you're in line to get a belt lipectomy. Belt because we're literally cutting off a belt of tissue, of excess skin and fatty tissue off of your body. And I actually do it in one piece. So you can actually see the whole darn thing like in one piece. And yeah, I know I show some gruesome pictures to my patients, but you know what? They love it because it actually brings it all home. It's like, wow, that's really that excess, that belt of tissue, of excess tissue that I had around my waist. So belt lipectomy or total body lift is something that we can do if you have the excesses in the full circumference of the body. And then just to extend it and make it just a little bit more complex, if we have the excesses all around, if you've lost a massive amount of weight, you can combine the belt lipectomy with the FDL component as well. And that, the FDL belt lipectomy total body lift, I know it's a mouthful, but that is one of the most powerful and elegant operations in all of reconstructive plastic surgery. It's circumferentially corrective, and it restores the body by reducing all of the excesses around the circumference of the body. It's a wonderful operation. And when I say this to people, when I mention it to them, they go, oh my God, the doctor wants to cut so much. But you
Yeah,
know
because
what?
that's what I was thinking. I was like, there's a lot of cutting.
And a lot of sewing as well.
Yeah.
But the reason why we would do that is because, again, it's so powerful and so elegant in what it can accomplish. It's just a tremendous operation. And if you're willing to undertake the scar burden, and by the way, the scars not nearly as bad as people would think, because we hide them under a bikini, a teeny weeny bikini or sexy lingerie, whatever you want to hide it under. My scars are super, super low. They always follow the contours of those bikini lines. And on the backside, dare I say, they'll be hidden by not just a bikini, but a thong bikini. If they're well placed, then these scars can be hidden and just camouflaged, and you can be on the beach showing it off. Now, the vertical scar, okay, you'll have to show that if you're wearing a two-piece. But you know what? There's that famous monokini with it's a top and then the bottom, and then
Yeah.
there's that front
Yeah.
portion that actually conceals that. I think that's one of the best inventions in swimwear of all time, specifically because it can hide beautifully my FDL belt lipectomy scars. So there's a few more permutations and different kind of adjustments that we can make to these operations. But what I've just described in the core of the body, those basic 4 operations, these are the ones that everyone in the massive weight loss community needs to be aware of and needs to at least consider when discussing the issues and even before starting their weight loss. So there's the extended tummy tuck, the FDL extended tummy tuck with that vertical scar, the belt lipectomy or total body lift, and the FDL belt lipectomy total body lift. With those 4 operations, you can cover 99% of all post-massive weight loss problems that people would be having. So that basically completes the core discussion. Want to talk about more?
to subscribe, hit that like button, and share this with someone walking their own path. Join the Facebook group and sign up at bariatricpaths.com to get all the details on upcoming events, support, and more. We're in this together. Go out there and crush it. This podcast is for support and inspiration only. It is not medical advice. Always talk to your doctor or care team about what's right for you.